So I'm Deepak Sahni, founder of Healthians, India's largest health test at home service. My journey of entrepreneurship started way back when I was in school. And I still remember I was studying in class 11 and the school had a fest. And by that time, all these does not used to happen. It's a very fancy sort of an event. But ours used to be a smaller fest, like a Diwali fest and a farewell fest. So the school used to sell the stalls to students and say, why don't you take a stall and start something and then probably entertain everyone who's coming in. So a lot of people took smaller stalls, 500,000 rupees, started doing something. I collected few of my friends and said, I want a DJ booth. They said, DJ is something that the school will put. We can't sell that. So I said, no, we want to make it a stall. They said, okay, it will be 5 times the cost so that we take off our stalls. We finally collected the money from home, opened the stall. And on that particular day, we started playing a DJ. To my surprise, there was no one who entered that stall. And we were thinking what we have done because the sound was going out. So people were enjoying outside and nobody was coming inside the stall to pay the money. Having failed at that particular point of time, I thought again, and within 10 minutes, the stall was full. We made 15,000 rupees that day. The only thing we did is we allowed some girls to enter for free. And you would know all boys entered and we made a lot of money. What I realized later was in the journey, that time I didn't realize what I did. But whenever I went back and said, what was the reason for that success? I realized that there is definitely an unmet need of every consumer. And most of the time, they even don't know what they want. You can't know what's that unmet need, but if you satisfy that need or a desire, you create a great business. Right. So that's where my journey started. I spent a lot of time in healthcare, technology, and next 10 years was completely into medical, into the hospitals, medical salary. Hospitals. I realized I looked at a lot of patients and I wanted to do something again to find out if I can again find another unmet need that people does not realize about. And today we have so many models like that really has satisfied certain need which never existed, right? One of the latest biggest example today is probably a Blinkit or a Zep, right? So we never had a need of somebody coming to us in 10 minutes because we were satisfied going down and buying it. Today, that need has been created because somebody thought of it, that it's an unmet need that they can create, but never existed. Similarly, in healthcare, spending a lot of time in hospitals, I started realizing when I used to talk to patients, everyone was very, very negative and dissatisfied. The single sentence I used to hear, hey, Bhagwan, hospital ki shakal mat dikhana. So no one wanted to be in the hospital. But I used to ask patients very clearly, okay, you don't want to be loining into hospitals, a negative place. You spend money, insurance pays, you pays, family gets alerted. What do you want? What do you do about it? They actually didn't know what they want to do about it. And that's where the whole journey of starting Healthier started, where I started realizing that people want to be not landing into hospital, but they also don't know what to do to remain healthy. And the start of preventive healthcare as an idea came where we combined healthy and Indians together to make Healthians. And I started thinking about how do we solve this problem for people. And the more we researched, we realized that people have many problems when it comes to preventive health. One, it did not exist. Nobody knew that actually something like that can be done. Or getting a test done without going to a doctor was never a scene. So you always want a prescription to do that. And at the end, there was a lot of issues. So we realized the issues were convenience, the issues were affordability, the issues were people had fear of being detected. Nobody wants to stop what they're doing by knowing they're unhealthy, right? So if somebody is smoking, you tell him you are unhealthy, stop smoking. He doesn't want to actually know he is actually unhealthy. So it's a big problem to have. And that's where we realized that there is a lot of behavioral change that is required. And that's where we started to solve this particular piece one by one by creating a service that One obviously provided a lot of convenience to people, saying that you don't have to take an off from your office. You don't have to go outside. You tell me at what time during the whole day you have a time and give us 5 minutes and we'll be able to come at your home and do the test. Second, the ease was very, very easy because using technology, you do not need to go to a doctor. You simply go online. You can be a 30-year-old. You tell me just about your habits and I'll be able to tell you based on these habits, this could be risk areas and you can take these tests. Or I can know your family histories and other physical activities and I can still tell you what you need. So you don't need a prescription, but you need someone guiding you to tell what sort of a test you need. And that's where the whole problem started to solve. We know affordability was a bigger issue, and unfortunately in healthcare, 30 to 40% goes to the people who refer, right? So we just eliminated the middleman, the referral fee reduced by 40%, and we started creating that affordability factor into it. Today, we proudly say that we are at least 60% lesser than the market, but still, a lot of people can afford. This change in few years became very, very big. And I have examples of stories and numerous number of stories where it helps people. Going back in 2014, 15, we went to one of the corporates. At that kind of time, there was another company in mobile called Aircel, not the Airtel, Aircel. And we were testing all their employees in their office, and I realized 30% of men over 35 were diabetic in that office. And we gave that startling figure to their HR, and they were like amazed how it is happening. And to my surprise, the company used to serve the food in the day and night both in the canteen. And that food used to always have one gulab jamun for everyone. And the office definitely had no practical practices of any sort of exercising and stuff. So we realized, and literally that office stopped their lift for next 3 months, that everybody had to come from stairs. And there was no Swedish or no dessert being served in that office for the next 3 months. We had seen a startling result. Starting from there, a very senior officer who's a doctor and works with DHS, which is the Haryana Healthcare Services, calls me one day and he says, "Thank you." I said, "For what?" He said, "I called in a guy for a simple test. He told me, sir, you are 45, you should take more tests. You should also get this tested, that tested and all." And I was literally angry on him that he's trying to oversell to me. Lately, I found it out that I'm a stage 1 lung cancer patient just because this guy suggested me that you should get this test done. There is we have actually diagnosed more than 200,000 cancer patients at an early stage 1 by doing this preventive health test. So the kind of an activity this has given us is people are now very, very aware, and that's where I started from, that post-COVID, the habits are being changing, and we have been really, really realizing that we have to remain healthy. And in this sort of a world, there was a need which was created 10 years back, that there is a support that you can have for keeping yourself healthy. And that's where the whole diagnostic piece started, reached at home. And now it is obviously going, it's basically in 250 cities. Overall, if I look at the new category being created with that particular change, and this new category today, if I talk about, has 4 million customers who are absolutely healthy, but take a preventive health checkup regularly every 6 months. That sort of a number. Overall patient base is much larger. There are a lot of chronic patients in India also, but just preventive patient and a category creation actually gave that sort of a number. So this continued as a journey, and I realized this will further continue. And specifically to everyone sitting here, I think I would like to encourage you to look at one thing around you. You might be in the services, you might be in the government, you might be at the school, you might be doing your own business. My advice to everyone is to look at that unmet need around you, and you will find a lot, and solve that unmet need which does not exist. And you would see the wonders happening for that change. Because a lot of time we expect that by doing a simple survey, our consumer will tell us what we want. But that doesn't happen. You have to find it yourself of that unmet need that doesn't exist and make it a big thing. And that's the way it should be. So today, I think I would like to end this up by telling you that it is when you have grit and perseverance to pursue all of these things, all these problems really, really take up. You overcome all these problems. Largely, if you talk to us, in our journey, we faced a lot of problems. Initially, the doctors never wanted to accept the reports that we wanted to give because we were bypassing them. It took us 3 years to satisfy them by telling them that we have the best of the citations, best of the machines, best of the stuff. Then patience. Behavior change is the most difficult thing. Telling somebody to spend the money and getting themselves tested when they are not ill was the biggest thing. Again, we have to tell people, I still remember our first campaign used to say, a cost of testing would be lesser than the cost of your mobile phone bills, right? And we had to change that particular habit that it will just take 999 rupees to get the test done. Similarly, when you are solving bigger problems, you will face a lot of problems. And by facing that problems, you have to overcome them with your grit and with your perseverance. So I would like to tell everyone that there is no fun in solving or changing things by just fixing up broken things. But the fun really lies in the change that you bring by actually meeting up the unmet needs. Thank you.